The White House urging governors to reinstate mask mandates with coronavirus cases rising across the country. Here's Andy SLAVITT on MSNBC this morning.
We're not out of this pandemic yet. We still have an accelerating threat. There's millions and millions of people that haven't yet been vaccinated. And so lifting all these restrictions, telling people not to wear masks, gathering in large crowds, that's the equivalent of playing with fire.
Joining me now, Dr. Aditi Nerurkar, physician at Harvard Medical School. Dr. Nerurkar, today Arkansas's governor ended his state's mask mandate. Alabama is ending its mandate next week. What are your concerns about those kinds of rollbacks at this stage of the game?
Hi, Allison. Nice to be here. So there's four main considerations when we're thinking about pandemic response. The first is, of course, the variants, right? 60% of the COVID cases right now are due to the variant B.1.1.7 from the UK, and that's not a good thing. The second is vaccinations. We're doing a great job with vaccinations and rolling out vaccinations to more people, increasing eligibility, but only 15% of our population is vaccinated at this time. And then the third is human behavior, wearing masks and these things that are so important. We know social distancing, hand washing, masks are critical. And finally, the mandates. These mandates are much disaligned with the CDC. Currently, the CDC has suggested, the director was on a press conference and said that there is a sense of impending doom. In January, throughout for the past several weeks, we've had a stable number of cases, and recently we've had a spike in cases. This is very concerning. The White House is very much aligned with the CDC right now, and the messaging is really clear. We are not out of the woods. We need to be very vigilant. Removing mask mandates is dangerous right now, and we don't want history to repeat itself. So even though we're doing everything we can with the vaccine efforts in the U.S., we really do have to be very careful. And the mandates are removing masks. It's just not the way to go.
One positive trend, as vaccine supply is ramping up, Americans do seem less hesitant to get the shot. 17% of adults say they definitely or probably won't get it. That is down from 22% in January, according to a U.S. Census survey. What would you say, though, to people in that 17% who are still reluctant to get a shot?
Yeah, vaccine hesitancy has been something that we've been working on and tackling for a long time over the past several months. There was a recent study done by the Kaiser Family Foundation, which showed that people are more willing to get the vaccine, but there is still a group. 3 out of 10 people in this poll found that they didn't know where to go for the vaccine, didn't know if they were eligible. So vaccine hesitancy is still an issue. Vaccines are critical to reversing this pandemic and getting it under control, getting us all immunized. We also have to really work on vaccine education and, most importantly, vaccine access. We need to make sure that we have enough vaccines for enough people and, most importantly, get the people to the vaccine so they can get vaccinated. That is critical and a critical next step for us.
A single dose of the PFIZER or MODERNA vaccine is 80% effective in preventing coronavirus infections, according to the CDC. But Dr. Fauci says do not skip the second shot. Here he is on CNBC.
We don't know how long that 80% is durable. It may drop off a cliff in 2 weeks or 3 weeks. The other thing is that even though it's 80% protective, the level of antibody that it induces is far lower than after the second dose.
Why else is it so important to get that second shot, to not just get the first shot, assume it's good enough, and walk away?
It is so critical. So we know with the Pfizer and Moderna vaccines, right, we need 2 shots, with Johnson & Johnson 1 shot. It is so critical to finish that vaccination regimen. So 1 shot gives us an 80% decrease in prevention of COVID, but 2 shots gives us a 90% decrease in the transmission, which is a wonderful study, which was just recently done, and it's a real-world example with healthcare workers. The reason 2 shots are better than 1 is because with 2 shots, we have the best possible chance of long-lasting immunity. With 1 shot, yes, it is 80% effective at preventing transmission, but we don't know how long that a protection lasts. There is an almost tenfold increase in our protection when we get the 2 shots, and 2 shots is much, much better than 1, and that is why we recommend it.
Dr. Nerurkar, thank you so much for the advice. I know this is your first time with us on the evening show here on News Now. I hope you'll come back again.
Thank you so much, Allison.